this is for nasal tracheal suctioning. So first we're going to check the patient's chart, make sure the order is in place, get our supplies, which would include the sterile saline, the sterile suctioning kit, and we would head to the patient's room. Hello, Mr. Blank. My name is Trisha, and today we're going to do some suctioning. You have that nasal airway in place, and we are going to go ahead and suction to get any secretions that you may have out for you, make you feel a little bit better. So can I get your name and date of birth? Okay, so the first thing we'll do is we're going to give you some oxygen. We like to hyperoxygenate the patient before, give them some oxygen after. So we're going to go ahead and put some oxygen on. So you have your oxygen supply, and then as they have the oxygen on, we're going to get our other supplies ready. We have suctioning set up in the room. We're going to turn on that suctioning to -100 to -120 for this adult. And then we are going to go ahead and get our, actually we're going to do some assessment. We're going to assess the patient's vital signs, how he's breathing, maybe feel his chest to see if we can feel those secretions. We're going to put on the pulse oximeter, and we're going to make sure that that's on through the process. We want to monitor that as we're going through this. So then we're going to open our suctioning kit, and we're going to put on our sterile gloves. We want to maintain one sterile hand and one clean hand as best we can. And then with our kit, we have some lubrication, and then we have sterile saline. So with the lubrication, we're going to open that, put that on the sterile kit, maybe on the lid so that stays sterile. And then we are going to pull our suction catheter, and we're going to test this to make sure the suction is working correctly. So with the suction catheter, connect that to our suction, and then we are going to put the catheter tip into sterile saline and occlude the thumb port. So we would put that in there, occlude the thumb port, and ensure that the sterile saline is seen going up through the catheter. So we ensure that this is working correctly. Then we are going to lubricate the tip of the catheter. So we're going to use that lubrication. You can either put it on the palm of your hand, or you can put it on the lid of the tray there. Either way, you can go ahead and get that nice and lubricated. And then we're going to remove the oxygen from the patient. So Mr. Blank, we're going to remove the oxygen and go ahead and get started. I will put this slowly through your nose, and when I instruct you, I'll have you cough a little bit. We'll get this through the vocal cords, okay? So we're going to go ahead and we're going to push this through the nair. We do not want to include the thumb port yet, so we're going to go ahead and push that through the nair. Slowly push that down through. When you feel the first resistance, that is the vocal cords. We'll instruct the patient to cough. We'll go just a little further. Second resistance is the carina, so then we're going to pull back very slightly. As we're doing that, we're going to occlude that thumb port. We're going to start twisting that catheter. So we want to twist that catheter and pull back as we're removing it. Get all of those secretions out there. This should be less than 10 seconds. The entire process should take less than 15, but the suction itself less than 10. So we've removed all the secretions. We want to make sure that the patient is free of the secretions, so we maybe want to feel their chest real quick to see if we need to do this again. If you still feel secretions, you're going to want to go back in one more time. You can only go in twice. You don't want to do more than 2 times in one setting, but we are finished, so then we would remove this. We're going to go ahead and put the oxygen back on the patient, and then we're going to do our after assessment. So we're going to get our vital signs again, just make sure those secretions have been cleared, look at the oxygen level, and then we're going to make sure the patient is comfortable. We've oxygenated the patient, asked him if he has any questions, asked him if there's anything we can get for him, and then we will document everything we've done. Thank you.